Greetings and salutations. This is Jeff Eaton. I'm your faculty member for Nursing 908. I'm going to use these slides to go over the syllabus. I think it's way easier to explain them than it is to look at them. Here we go. So the mission and vision is on all syllabi. Basically, you can read this as well as I can. Basically, we're trying to make you good at what you do, use evidence-based practice when you do it, and also be citizens of the profession and the world. Who am I? Jeff Eaton. I have been a nurse now for, since 1978, so you figure it out, well over 40 years. I've been a nurse practitioner now since 1989, so about 30 years of that. So I have a little bit of experience. I have done basic med-surg nursing. I did that for about 8 or 10 years. I worked as an agency nurse in Boston, so I worked all over the city. I ended up getting my master's as a nurse practitioner. I've done inpatient hospitalist work for that. I've done primary care. I've done emergency room. I've done walk-in urgent care. I've done all sorts of different things. I think it's given me a pretty good perspective, but you will notice that everything I've done has been pretty much generalist. And so I'm going to attack this course as a generalist. Some of you may already be specialists, you may already be deeper and have better knowledge of some of these topics than I do. That's fantastic. But again, this is a survey course. It's intended to be broad. Family practice is a mile wide and an inch deep. So I know a little about a lot of things. There's a bunch of things I don't know about, and I look forward to learning from some of you this semester. But I think we'll have a good time. Right now, I work full-time as a family nurse practitioner in South Berwick. I have been teaching 1 day a week for the past roughly 10 years at the University of Southern Maine. Prior to that, I was a full-time faculty member at UNH for 13 years, and so I've been teaching for a very long time. I did teach this particular course for most of that 13 years that I was at UNH. So a lot of things have changed, but a lot of things haven't. So I do think that you need to communicate with me as much as you possibly can, both on the discussion board, by email. I think the discussion board is better because if you have a question, chances are 4 or 5 of your other colleagues do as well. So I'm going to do my best to make this course feel relevant. I really try to avoid a lot of text stuff, the too long didn't read stuff. And that's one of those things that unfortunately I think is a real challenge, is that so many of us will look at a textbook and spend a half an hour reading it and then really not remember anything that we read. None of the exams will be in class or pressured. They'll all be online. They'll be open for a week. So this is intended to be an achieving competency course. It isn't intended to be a memorization course. So I, as I say, I have a full-time family practice. I am there Mondays, Tuesdays, Thursdays, and Fridays, long days. I usually do my notes in the evening on those days. So mostly I'm going to have Wednesdays and some of the time on weekends dedicated to this course. I do usually see emails within a day or so. But to be honest with you, I don't always answer them because if they do take a thoughtful response, I want to leave them to a time that I can actually do that. So I will try to get back to you as soon as I can, but I don't promise to get back to you within a day or two. In the contact information above was my cell phone, so if you really need me, go ahead and text me something or possibly call, although to be honest with you, if I'm with patients, I probably won't answer. Keep in touch with me. So we're going to look at a lot of normal physiology. We're going to look at a lot of pathology. Again, some of you are really going to know a lot of this stuff already, but for others of you, this is all going to be pretty new. So what are we going to do? We're going to compare and contrast physiologic changes over the lifespan. So we will look at aging as part of this process. We're going to look at altered states. So basically that's pathophysiology and disease states. We're going to try to apply evidence-based practice. This is a little bit more challenging with physiology than it might be for, say, pharmacology, but we will do our best to do this. We're going to look at pathophysiologic principles for advanced practice and bedside nursing and basic nursing. We're going to look at health variations. We're going to look at developmental physiology. And we're also going to try to figure out how this may apply to health promotion, especially for topics such as, lipids or exercise or some of those kinds of things. Really, though, my true objective is to make sure that you have the skills to be a self-directed, lifelong learner. There will always be coming up things for you that are learning issues. I have 4 or 5 every single week that I have to come back. I have to spend time looking up. I have to know what resources are reliable to look them up on. I have to be able to synthesize that information, and then I have to be able to take that information and use it with patients. So for textbook, the textbook that's been used for this course previously is online for free. So just go ahead to this site. I will put it on Blackboard as a link as well. I'm sorry, I'll put it on Canvas. As you can tell, for the past 30 years, I've been using Blackboard. So if I say Blackboard, please just insert Canvas in your brain. The 8th edition is available as well. Not that much changes in physiology, so I'm not going to ask you to buy the 8th edition. I think you can rent it for a semester for about $75. To buy it's probably going to be well over $100. But again, there's so many great resources on the internet that are free. I really just don't think you need to do that. The Merck manual is available online for free. We'll use that some. I'm a big fan of eMedicine, which is actually a subset of Medscape. That's available online for free, and I believe UNH, through UNH, you have access to UpToDate. That's a good reference. It's actually not my favorite, just because UpToDate always has both scientifically based information and also the opinion of the author that's writing there. They're very clear on which is which. The problem is that then clinicians and colleagues will say, well, UpToDate says to do X. And you're not sure whether that was the evidence-based practice section of UpToDate or the opinion section of UpToDate. So, as I say, it's a good reference, but just be careful with your use of it. I'm going to post all of my talks on YouTube. I have not worked with Kaltura much, but they tell me that those can be added on the Blackboard as well. I'll be sending these to the educational specialists, and hopefully they'll be able to convert them. I believe that those will have closed captioning. They'll have a summary, so they may be, in fact, more useful. On the other hand, I tend to put them on YouTube to make them available to the world and to you at any time in the future. So I use a lot of other things from YouTube. I'll be posting a lot of other links. I love MedCram. Khan Academy isn't bad. There's a whole bunch of different things online that you can access that will explain things very nicely. Again, some of them are long and they're hard to watch. Others are short and succinct. So we'll try to curate that for you as much as we can. And obviously, I'll appreciate any links that you can put on the discussion board, any useful resources that you find on the internet. So time, this is one of those things that is very challenging because many people have part-time jobs, many people have full-time jobs, and they expect to be able to go to a 3-hour class, sit down, learn everything that they need to learn. Now, obviously, doing an online course, you don't have that expectation, but you need to understand that from the graduate school, they tell us that every student should be spending the 3 hours of class time and then a number of hours after, 6 to 9 hours, studying, looking things up, manipulating things, doing reading, and you have to allot enough time to do what you need to do. The exams are very time consuming, I will warn you. There's a lot of very detailed information on them. They're online. You're expected to look them up. They're open book. So obviously there's going to be a lot of challenging questions on those. So, you know, the other thing that you see is people will schedule a vacation during class time. I'm not saying you can't get away with this, but boy, I think you're taking a risk, and I think it's really, in general, a relatively bad idea to do this during the time that you're taking this kind of a course. If you have something big going on in your life, you know, illness, death, something, and you need delay for deadlines or whatever, please let me know. You know, as I say, sometimes we do ask for documentation, but in general, unless there's some abuse, that's not going to be the case. But I have several rubrics that I will post for the presentation, for the participation, and just be very aware of those because those will affect your grade. I hate to be grade oriented, but unfortunately we do need to provide you with some feedback. So again, on Canvas, class participation, there will be that rubric. There is expectation that you will be posting every week for discussion questions. I do put some very specific questions up on Blackboard. They seem to be pretty easily embedded in the individual modules, so you'll know where to put them. They can be a muddiest point, you know, something that you'd love the group to help you understand. Something that you had an aha moment for where you're like, oh, geez, I always thought this was X, and in fact, wow, it's Y. I think those are really useful because chances are, again, if you're thinking that way, there's probably other folks that are thinking that way as well. So if you have an interesting case from work, if you have an interesting case from your family that you want to put on, and obviously observe confidentiality laws, it would be great to help people think things through. So the grading, so 20% will be based on that Blackboard participation rubric. And when it says Blackboard, again, it means Canvas. There will be a home study case that will be posted. I will very clearly make the due date on that. The midterm is about halfway through the course. The final exam is at the end of the course. Again, these are exams which are open for at least a week, have about 100 questions, and you are expected to figure those out. A bunch of them will be from, quote unquote, the reading. Now, that being said, you may actually be able to find them as well or better by looking somewhere else, but there will be some that I will have taken from the textbook. You are expected to do a presentation on YouTube or a PowerPoint narrated presentation. We can talk more about how to do that on the discussion boards if people have a challenge with that. But basically, I'm going to give a list of cases that I would like people to present. We'll have a sign-up sheet on Blackboard, and whoever signs up for it first gets to do that one. That's going to be about 25 presentations. My expectation is that each of these presentations will be about 8 or 10 slides, so about 6 or 8 minutes. This will be one of the classes, quote unquote, one of the weeks will be allotted for doing student presentations, reading them and watching them. On the other hand, I will put due dates earlier so that they don't all come in at the very end. They'll start to be due after about the midterm. Quizzles will be posted about every 2 weeks. There'll be 6 to 8 questions. These will be open. You can take them as many times as you want to and look things up. Again, oftentimes these will be topics that we haven't covered in class. And the intent is for the quizzle to stimulate you to read about them, think about them, and learn about them. So I can't emphasize enough how important it is to communicate. We just need to keep in touch and, you know, really act as a team. And I think we can get to our objective.